Hello, my incredible friends. I'm Dr. Lily, your guide and companion in women's health, with over 20 years of experience helping women just like you step into their power. Today, we're diving deep into a topic that's close to my heart and yours, your sexual health. This isn't just about safety tips or dodging risks, it's about celebrating your body, owning your choices, and reclaiming the strength that's already inside you. So, grab your favorite drink, coffee, tea, water, whatever fuels you, find a comfy spot, and let's have a real, honest chat. Think of me as your trusted friend who's been around the block and has the science to back it up. Oh, and don't go anywhere, I've got some questions sprinkled throughout to get you thinking and sharing in the comments. Ready? Let's do this. Here's the deal, your sexual health isn't some side note in your life, it's a cornerstone. It's not just about avoiding STIs or unplanned pregnancies, though we'll cover those in detail. It's about how you feel about yourself, how you connect with others, and how you take charge of your future. I've seen it time and again in my practice, when women prioritize this part of their lives, everything else starts to glow a little brighter. And don't worry, we're going to break it all down with practical steps, hard science, and a whole lot of encouragement. Because you deserve to feel unstoppable. Let's kick things off with the why. Why does sexual health matter so much? Well, it's not just about the physical stuff, though that's huge, it's about your whole being. A fascinating study from the Journal of Sexual Medicine in 2016 found that women who actively manage their sexual health report higher self-esteem, lower stress levels, and stronger connections in their relationships. Think about that for a second. When you're confident in this part of your life, it's like unlocking a secret boost for your mind and soul. I've had patients walk into my office feeling lost or ashamed, and by the time they leave, armed with knowledge and a plan, they're standing taller. One woman, let's call her Sarah, told me, "Dr. Lily, I didn't realize how much power I had until I started asking questions." That's what I want for you, power. Not fear, not uncertainty, but a deep, unshakable sense that you're in control. So, here's my first question for you. What does control over your health mean to you? Is it peace of mind? Confidence? Something else? Drop it in the comments, I'm dying to hear your thoughts. And it's not just about you, it's about the ripple effect. When you take care of yourself, you set the tone for your partners, your friends, even your kids if you've got them. You become a beacon of strength. That's not fluff, that's science and real life colliding in the best way possible. Now, let's get into the nitty-gritty, protection. If I could hand you one tool to start with, it'd be a condom. Why? Because it's a game changer. The Centers for Disease Control and Prevention, yep, the CDC, says that when used correctly every single time, condoms cut the risk of HIV transmission by over 90%. That's not a guess, that's data from decades of research. They also slash the odds of picking up chlamydia, gonorrhea, and syphilis. It's like a tiny shield for your big, beautiful life. But here's the catch, correctly is the key word. I've seen so many women in my practice who didn't realize there's a right way to do this. Step 1, check the expiration date. A condom past its prime is a risk waiting to happen. Step 2, store them smart, your wallet or a hot car glove box? Nope, that's a recipe for damage. Keep them in a cool, dry spot. Step 3, timing. It's got to be on before any skin-to-skin contact, not halfway through. I know, it sounds basic, but these little details are where the magic happens. And let's talk options. Latex not your vibe? Maybe you've got an allergy, about 1 to 6% of people do, according to the American Academy of Allergy, Asthma and Immunology. No problem, polyurethane condoms are here for you. They're just as effective and feel a little different, which some folks actually prefer. Then there's internal condoms, yep, they exist. They go inside, giving you even more control. It's like a buffet of choices, and you get to pick what works for your body. But protection isn't just condoms. If pregnancy's your main concern, hormonal options like the pill, patch, or an IUD can step in, over 99% effective when used right, per the Guttmacher Institute. And for oral or other kinds of intimacy? Dental dams and gloves are your unsung heroes. They're not as mainstream, but they're just as fierce. The point is, you've got a toolbox, and it's yours to customize. So, tell me, what's your go-to protection method? Or maybe you're curious about trying something new? Let's chat about it in the comments. Okay, let's shift to something less tangible but just as critical: communication. This is where the rubber meets the road, pun intended. A study in the American Journal of Public Health found that couples who talk openly about sexual health are way more likely to use protection consistently. Why? Because when you lay it all out, your needs, your boundaries, your history, you're building a foundation of trust. And trust? That's the bedrock of intimacy. I get it, starting that conversation can feel like climbing a mountain. But it doesn't have to. Try this: hey, I really care about us, can we talk about what keeps us both safe and happy? It's not confrontational, it's caring. I had a patient, Maria, who was terrified to ask her boyfriend about testing. She practiced that line with me, went home, and said it. Guess what? He was relieved. She'd opened the door he didn't know how to knock on. They got tested together, and she told me it was the strongest their relationship had ever felt. But here's the flip side: if your partner shuts down or gets defensive, that's a signal. You deserve someone who meets you halfway. I've seen women twist themselves into knots trying to please someone who won't listen. Don't do that, you're worth more. So, let's get real. Have you ever had a tough talk like this? How did it go? Did it surprise you? Spill it in the comments, I'm here for every word. Next up, knowing your body inside and out. Regular testing isn't just for other people, it's for all of us. The World Health Organization dropped a jaw-dropping stat: over 1 million STIs are acquired every single day globally. That's not to scare you, that's to wake you up. Many of these, like HPV or herpes, can hang out silently with no symptoms. I've had patients shocked to learn they had something they couldn't feel. Testing isn't about shame, it's about clarity. So, what does that look like? Get a pap smear every 3 years if you're 21 to 65. It screens for HPV, which can lead to cervical cancer if ignored. Add an HIV test, quick, often free at clinics, and whatever else fits your life. I tell my patients, you check your car's oil, right? This is your body's tune-up. And if you're nervous? Totally normal. I've held hands through tears, not from bad news, but from the relief of knowing. You're not alone in this. One of my favorite stories is about a woman named Jenna. She'd put off testing for years, scared of judgment. Finally, she came in, got screened, and everything was clear. She hugged me and said, "Dear Lily, I feel like I can breathe again. That's what I want for you, freedom." So, what's one health step you've taken that you're proud of? Maybe it's a checkup, a question you asked, anything. Share it below, I'll be cheering you on. Let's take a detour and smash some myths, shall we? I hear these all the time in my office, and they drive me up the wall. Myth 1: you can't get an STI from oral sex. Wrong. The New England Journal of Medicine has case studies showing HPV and herpes can absolutely spread that way. HPV's linked to throat cancers, too. Myth 2: pulling out works. Nope. Pre-ejaculate can carry sperm and STI risks, per the Planned Parenthood Federation. It's not a strategy, it's a gamble. And here's a sneaky one: if they look healthy, they're fine. Oh, honey, no. The CDC says up to 80% of chlamydia cases in women have no symptoms. Looks don't tell the story, tests do. Knowledge is your armor, and I'm here to hand it to you. What's a myth you've heard that threw you off? Let's bust it wide open in the comments. Here's where it all ties together: empowerment. This isn't just about dodging risks, it's about claiming your right to a healthy, vibrant life. Carry condoms in your purse, I do. Ask your doctor the hard questions. Say no when it doesn't feel right. Every move you make says, I'm worth it. And you are. Science, experience, and my whole heart agree. I'll never forget a patient named Aisha. She came to me feeling powerless, her partner wouldn't use protection, and she didn't know how to push back. We talked strategy, she practiced saying no, and a month later? She was beaming. Dr. Lily, I stood up for myself, and it felt amazing. That's you, too. So, what's your next step? Booking a test? Having that talk? Just feeling proud of where you're at? Tell me in the comments, let's lift each other up. Wow, we've been on a journey today, haven't we? From condoms to courage, this is your story, and I'm so honored to be part of it. If this hit home, smash that like button, it helps more women find this vibe. And please, drop a comment. Tell me your city or country, let's see how global this sisterhood is, and share your thoughts, your wins, your questions. Rate this video out of 10, too, I'm all about your feedback. Hit subscribe if you're not already in, I'm here every week with more ways to empower your incredible self. Until next time, keep shining, keep choosing you, and let's keep this conversation alive. See you in the comments, my friends.